Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, everyone, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, your host. Today, we're examining a critical topic: how financial relationships between pharmaceutical and medical device companies and medical specialists may affect patient care. We'll be discussing new findings that billions of dollars in non-research payments were made to U.S. physicians between 2020 and 2023. Our goal is to help you understand these industry ties and what they mean for healthcare choices. Here with me is my co-host, Ilara Sky, who focuses on natural health and provides practical insights to help clarify these issues. Ilara, thanks for joining me.
Thanks for having me, Ethan. These numbers are quite substantial, and it's important that we address them. According to recent data, specialists across multiple fields, from neurosurgery to oncology, received billions of dollars in payments that didn't relate to research studies. Instead, these funds went directly to physicians as consulting fees, gifts, travel, meals, royalties, and other forms of compensation. There's concern that such financial incentives could influence prescribing habits, increase healthcare costs, and create bias favoring certain products that may not necessarily benefit patients.
Precisely. One report shows that between 2020 and 2023, non-research payments from the pharmaceutical and medical device industries to physicians exceeded $8 billion. Also alarming is that the number of doctors receiving these payments rose by roughly 28% in that same period. While many of these payments might seem small, like meals or sponsored events, there's evidence suggesting that even modest perks can sway a physician's judgment. For instance, a study found that doctors who accepted industry-sponsored meals with a median value of just $17 were more than twice as likely to prescribe a new heart failure drug to Medicare recipients.
This illustrates how seemingly minor gestures can have a sizable effect on medical decisions. Experts warn that these payments can lead physicians to favor expensive branded medications or certain devices when there might be more cost-effective or safer alternatives. In addition, the presence of these incentives often remains hidden from patients, leaving them unaware of the potential influences behind clinical recommendations. While the American Medical Association has suggested that industry ties don't necessarily mean compromised judgment, the evidence supporting a link between gifts and prescribing behavior is steadily growing.
When you look at specific specialties, the sums involved become even more concerning. Neurosurgeons in the United States, for example, reportedly received around $479 million in general payments between 2019 and 2023. A large portion of these payments came in the form of royalties, licensing fees, and consulting arrangements. Meanwhile, oncology specialists were on the receiving end of over $600 million in non-research payments during a span stretching from 2017 to 2023. Hematology oncology in particular accounted for a significant share, with many of those funds linked to industry-sponsored conferences.
There's also the matter of anesthesiology. Research shows that about 3/4 of actively practicing anesthesiologists received nearly $300 million in non-research payments between 2014 and 2023. Crucially, just 1% of these professionals accounted for around 75% of the total money. Specialists in pain medicine were especially affected, receiving payments 8 times higher than general anesthesiologists. On top of that, a notable portion of nurse anesthetists and other non-physician anesthesia providers also got industry money. Those sums have gone up over time, both in terms of total amounts and the number of people receiving payments.
Let's not forget orthopedic surgery. In one study, about 600 orthopedic surgery fellowship program directors collectively received more than $340 million from 2015 to 2021. Most of that money came from royalties and licensing fees, often because these physicians held patents on certain medical devices. Spine surgery and shoulder or elbow surgery, directors stood out for taking in the highest amounts. One of the main concerns is that if a surgeon has a financial stake in a particular device, it can skew decisions about what to recommend for a patient in need of a joint replacement or other surgical intervention.
We see a similar trend in radiology. Between 2017 and 2021, radiologists received at least $100 million in payments, such as royalties and ownership fees. A study specifically looking at neuroradiologists found that nearly half of these professionals had received at least one industry payment during a 5-year period. While many of those transactions involved gifts, there were also considerable sums from speaker fees and consulting. The top 5% of recipients made up almost half of all payments in that specialty.
Indeed. And these patterns extend into other areas, such as endocrine surgery. More than 400 members of the American Association of Endocrine Surgeons collectively received close to $6 million from 2014 to 2020. The most common forms of payment were food and beverage, travel and lodging, and consulting fees. There's also a growing trend in specialties like allergists, dermatologists, gastroenterologists, otolaryngologists, and pulmonologists accepting payments for promoting certain treatments, in one case, an eczema drug, through speaker fees and sponsored events. The total amount quadrupled from 2017 to 2023 in some of those fields.
The Physician Payment Sunshine Act makes it possible to track these transactions. Under that legislation, manufacturers are required to report anything above $10 in value given to healthcare providers, whether it's a meal, travel, or a speaking engagement. However, there's no federal law limiting what an individual provider can accept. While some institutions impose their own restrictions, these aren't uniform. As we've seen, transparency doesn't automatically stop financial ties from influencing patient care. Researchers argue that once money is in the mix, it's difficult not to be swayed by it on some level.
That's a key point. Transparency is a step in the right direction, but it isn't enough by itself to eliminate bias. Several experts in the field maintain that any gift, even a small one, can shift a physician's perception of a drug or device. This shift might be unintentional, but it often results in higher prescribing rates for expensive brand name medications, as well as a general tendency to order more products. Over time, these behaviors can dramatically increase overall healthcare costs and expose patients to unnecessary interventions.
As patients, it's essential to know that these financial arrangements exist and that they're quite common. The Open Payments Database is a resource for the public to see if their healthcare provider has received payments and from which companies. Patients can look up the details and ask questions about whether such relationships might influence their care. Experts in these studies emphasize the need for ongoing scrutiny. They also point out how important it is to ensure innovation doesn't overshadow unbiased clinical decision-making. By staying informed and engaged, patients can advocate for treatments truly aligned with their best interests.
That's exactly right, Alara. It brings us to the close of today's episode. We hope this discussion helps you understand the magnitude of industry payments to physicians, the potential impact on prescribing habits, and what it might mean for you. And with that, I guess we'll wrap up. You've been listening to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and I appreciate you spending this time with us. As always, our goal is to keep you informed on developments in healthcare and empower you to make the best decisions for yourself and your loved ones. Alara, thank you for sharing your insights.
Thank you, Ethan. It's been a pleasure speaking with you on this crucial topic. We encourage our listeners to explore the Open Payments Database if they're curious about their own healthcare providers and to continue seeking reliable information. We look forward to discussing more important health matters in future episodes. Until then, stay informed and take charge of your well-being.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.